Well, so what is the procedure of getting a coronavirus test done? And in fact, today I tried doing it, was almost there, but of course did not get inside in order to avoid, because I do not have any symptoms of it. But I am here outside RLM Hospital in New Delhi and spoken to a lot of prospective patients and people who've been standing there in long queues. And as you can see in visuals, these are the people who've been standing for past 4 hours in order to just get a quick test done, which is supposedly of 5 minutes. So, well, how does it start is here that you are given this form, and this form, if you can have a look at it, asks for your name, your age, your phone number, and very, very specifically the symptoms that you have. That is fever, sore throat, running, breathlessness, others. It also asks for your travel abroad history. It asks if you have ever come in contact with a confirmed case and the details of a confirmed case. Well, after you submit this form goes to room number 1. Well, now what is the procedure divided is into 2 rooms, where room 1 has 2 medical practitioners and room 2 has 2 medical practitioners. Well, it's ironically coincidental and of course unfortunate that with so many people and 24 facility, there are only 4 medical practitioners looking into, and that's why the wait has been pretty long, with people waiting for 4 to 5 hours wearing their masks and trying to make it through the test. Well, as you submit this form, the medical practitioner supposedly to take 5 minutes and come out with an answer. And in case you do not have any of the symptoms, that is after reading your form, if they think that you do not have the major symptoms and that you haven't probably traveled abroad or probably traveled abroad but do not have symptoms, you're given a manual prescription that says that you would not need to undergo any kind of test, and you're asked to leave for home or for wherever you're going. But in case that your form undergoes one of these symptoms and that medical practitioner thinks that it's important for you to undergo a test, well, you will be taken into room 2, where there are 2 practitioners already sitting, and it's a 2-step procedure that's performed on you. Step 1, they'll be inserting certain kind of cotton balls inside your nose in order to take a part of your a certain part and under it and make it undergo for a test. And secondly, a rod along with cotton is inserted inside the depth of your mouth, which is near the neck part of area, to take of course parts of saliva and also from the neck side in order to undergo and perform the test. Well, after this you are asked a couple of questions. Well, here is the point that you are asked in case you want to be hospitalized, keeping in mind that you have symptoms according to this form that you have submitted. Well, most of the people that I've spoken to have been asked that, and they denied, because they said that until reports come, we'd like to stay home. And report takes about 5 days to come, minimum 3 days to maximum 5 days. So basically 5 days after your test is done, you are allowed to go home, allowed to stay with family, allowed to move around in case you want to, until of course it comes out positive or negative depending on the symptoms that you have. Well, people are given a choice if they'd like to be hospitalized, keeping in mind the kind of resources that hospitals do have. Well, here's a look at the visuals that you can also see that how these tests are performed. Well, my suggestion is go for it. If you have symptoms, don't go for it for the fun of it, keeping in mind that the resources are limited and there are less medical practitioners, since there are no private labs which are roped in yet, and only government authorities and government hospitals are allowed to do it.